Om Swastiastu. Good morning, doctors. We are from Group B7. We're gonna present about attention deficit hyperactivity disorder, or we can call it ADHD. Please enjoy.
Hi, my name is Manigandan Mandamohan Pillai, and the last three digits of my name is 249. Today I'll be talking about the background of ADHD. ADHD is attention deficit hyperactivity disorder, and it's a neurodevelopmental disorder characterized by inattention, excessive activity, and impulsivity. ADHD is mostly prone in kids than adults. The second part that I'm going to talk about here are the research questions. What is ADHD? What is the etiology of ADHD? And what is the diagnostic criteria of ADHD? What is the treatment of ADHD? What are the medical examinations used to assess ADHD? The third part that I'm going to talk about here is the purpose of studying ADHD. The purpose is to develop deeper understanding of ADHD, to understand the etiology and diagnostic criteria, to understand the several types of examinations of ADHD, and lastly is to understand how to handle ADHD efficiently. The benefits of studying ADHD are to identify the risk of substance abuse in ADHD patients. Traffic accidents and violations are more frequent in drivers with ADHD. As well, there may be an elevated likelihood of obesity among individuals with ADHD. That's all for today. Thank you, and my friends will continue the next part.
Hello, my name is Nanda Pramesdi with student number 167. Now I'm tell about what is the definition attention deficit hyperactivity disorder. ADHD is a psychiatric disorder that affects the activities of child to function properly. The child with ADHD like the symptom hyperactivity behavior, difficulty completing the tasks, a resistance of focus something, lack of sting, and also lack of caring. The children can be diagnosed with the ADHD if the symptom before the age 12 and last for 6 months, and also the symptom interfere their daily activities. Executive dysfunction in frontal lobes such as decision making also affect their social interaction, performance, and also their work in their daily activities. Thank you.
Hello, my name is Dara Cynthia Augustine, name 069, and I would continue my friend explanation about ADHD prevalence. So, as we can see in the slide, the prevalence of ADHD among children and adolescents is approximately 2.2% globally. And this data was based on epidemiological study which is conducted by World Health Organization and World Mental Health Survey in 20 countries around the world in 2016. Boys continue to be more than twice as likely than girls to be diagnosed by ADHD. And then, the ADHD is usually diagnosed in 6.2 age of average, and the younger age of the patient was diagnosed is the more severe ADHD would be. As we can see on the slide that the severe ADHD is usually diagnosed in the youngest age if we compare to the moderate and the mild ADHD. Many ADHD patients also have co-occurring condition, at least one other mental, emotional, or behavioral condition. For more specific data, it can be seen in the slide. And then, the ADHD is also reported to continue into adulthood. For the prevalence of ADHD in adults is approximately 2.8% globally. This data is also based on epidemiological study that I was mentioned before. In Indonesia, the ADHD itself is ranked in the 10th place as one of mental disorder that can contribute to cause disability in Indonesia.
Hello, my name is Rujan Skosasi with last digit student number 021. So I'm going to explain about the etiology of ADHD. Etiology of ADHD is unclear. However, the combination of genetic, neurological, and environmental factors is believed to contribute in the development of this disorder. The etiological factors that are meant to play a significant role in ADHD is genetic factor, and based on several studies that have been carried out, as much as 70% on average genetic factors take part to the cause of ADHD. And evidence from family, twin, and adoption studies has suggested strongly that ADHD is highly hereditary, and ADHD is also caused by non-inherited neurological factors that affect the brain development and resulting in brain injury, which could affect the catecholamic metabolism in the cerebral cortex.
Hello, my name is Putra Pinyama Sadana Ardika with student number 239. Now I will explain about the risk factors of ADHD. ADHD risk factors is divided into two main factors such as biological factor and psychological factors. Some biological factors that believe can lead to ADHD such as diet, smoking during pregnancy, cigarettes, alcohol contamination, viral infection, low baby weight, and exposure of environmental toxin. In psychological factors, ADHD sufferers are likely to be found in chronic family conflicts, decreased family cohesion, and psychopathological exposure from both parents compared to a normal family. That's all about my explanation. Thank you.
Hello, my name is Zaki Arafi ID, last name 122. So today, I will explain about manifestation of ADHD. First, on children and teenagers. According to the name, there are two groups of clinical manifestation, which is inattention and hyperactivity. Inattention manifestation include not paying close attention to tasks, missing small details, rushing through tasks, not seeing to listen in a conversation, difficulty organizing things, not finishing work, dislikes or avoid tasks that take sustained mental effort, losing thin, and being forgetful. And also, hyperactivity manifestation include fidgeting, always on active stance, leaving their seat, climbing on things, being loud, blurting out answers, talking excessively, having trouble waiting, and shrug or intrudes on others. Now, how about in the adults? ADHD symptoms in adults may have different manifestations such as procrastination, mood instability, and low self-esteem. Usually, ADHD in adults only manifested into an inattention. There are no hyperactivity. Usually, patient or their caregiver complains about occupational difficulties, disorganization, and tendency toward procrastination, anxiety, insomnia, and demoralized and self-deprecatory representation of depression often accompany this symptom. Thank you.
Hello, my name is Shantika Aprilia Ramawati with my student number 106. Here I want to explain the diagnosis of ADHD. In diagnosing ADHD, there are two groups of age with different diagnostic criteria: childhood diagnosis and young adulthood diagnosis. In childhood diagnosis, patients should be on 3 until 16 years old. Here, parents and teacher observation have big roles to help physician to make the proper diagnosis. One of the diagnosis assessment is SDQ with some checklists there and have been put on the slide. In childhood diagnosis, mothers or teachers should report 6 or more symptoms over past 6 months, and the other informant have endorsed at least 2 symptoms, and the details are been displaying symptoms continuously for at least 6 months, started to show symptoms before age 12, been showing symptoms at least 2 different settings, symptoms that make their life considerably more difficult, symptoms that are not just part of developmental disorder or difficult phase and are not better accounted for by another condition. Next, we jump to the young adulthood diagnosis. In this group of age, the patient should be at least 18 years old or older. Patient have to have 5 or more symptoms, and the diagnosis cannot be confirmed unless the symptoms have been present from the childhood. So that the requirement of symptoms onset before 12 years old was met if parents or teachers reported more than 2 symptoms at any childhood assessment. The symptoms can be underachieving at work or in education, driving dangerously, difficulty making and keeping friends, difficulty in relationship with partners. The important point of young adulthood diagnosis if the problems are recent and did not occur regularly in the past, it's not considered to have ADHD or can be classified as late onset ADHD. This is because it's currently thought that ADHD can develop for the first time in adults. Thank you.
Hi, my name is Putri Indria and my student number is 200, and now I'm going to explain about medical examination. So in order to diagnose ADHD, physicians or doctors need to do some medical examination, such as physical examination. And in this physical examination, doctors or physicians need to focus on the patient's history. And in this history, physicians or doctors need to ask whether or not the patient have allergies, have asthma, have tics, epilepsy, and as well as their psychiatric and neurological symptoms. And other than getting information from the patients themselves, physicians and doctors need to also gather information from their relatives, such as their parents. The questions that need to be asked with their relatives is related to developmental milestones, such as the age they started crawling, the age they started walking, the age they started talking, and as well as their grades when they were younger, their friends, their environment, and as well as special needs. That's all I can say about medical examination, and will be continued with my friends.
Hello, my name is Pratista and my student number is 227. So I'm going to explain about the differential diagnosis and comorbidity of ADHD. Differential diagnosis of ADHD is most commonly comorbid with other psychiatric and neurodevelopmental conditions such as anxiety disorder, bipolar disorder, specific learning disorder, and autism specific disorder. Anxiety disorder is a mental condition that is manifested by excessive anxiety accompanied by behavioral, emotional, and psychological responses. Individuals with anxiety disorder have difficulty sleeping at night, which causes restlessness, throws temper tantrums, and become attention-seeking during the day. Some of the symptoms may be misinterpreted as ADHD. The second is bipolar disorder. Bipolar disorder is a chronic disease that causes abnormal mood swings. There are several symptoms that can be found in individuals with bipolar disorder and ADHD, such as logorrhea, or continuous talking, instability, and psychomotor disorder. However, most individuals with ADHD do not experience bipolar disorder, in which a person with bipolar disorder experiences psychosis, decreased sleep requirements, euphoria, and hypersexuality. Third is specific learning disorder. Specific learning disorder is a neurodevelopmental disorder involved in understanding or using language, spoken or written, which can manifest in imperfect abilities to listen, think, speak, read, write, spell, or to do mathematical calculation. Children with SLD need to be screened for other disorders such as hearing loss or motor impairment could make the trouble worse. Meanwhile, for ADHD children, in cases of speech and language difficulties, doctors should also screen for hearing processing disorder. And the last one is autism-specific disorder. Autism-specific disorder is a neurodevelopmental disorder that affects behavior and communication. It can be associated with deficit in social communication, limited and repetitive behavior. Individuals with ASD tend not to care about other people because they are absorbed in their own world. Meanwhile, individuals with ADHD are more open to the outside.
Hello, my name is Hada Prabu with the student number of 253, and I will explain about the course and prognosis of ADHD. So, ADHD has negative impacts in adulthood by showing defects in social ability, academic ability, problem solving, and work functioning, with the symptoms of failing to pay attention, overworking, forgetfulness, severe anxiety, and vulnerable to severe stress during challenging time, such as in educational and work settings. ADHD has worse prognosis if combined with comorbid mental health factors, as shown by the data that 38.3% of adults with ADHD have mood disorder, 47.1% has anxiety disorder, and 15.2% has comorbid substance abuse or SUD. Individuals with ADHD also tends to have financial problems because of the low performance in work settings and the risk-taking behavior. Although there is no cure for ADHD, the prognosis could be better if treated with the right treatment.
Hello, my name is Putu Andreas Sebastian and my student number is 143. So I'm going to explain about treatment of ADHD. There are two kinds of intervention that can be done. The first is psychosocial and consists of three modalities. The first is direct contingency management that uses systemic manipulation of reward and punishment. The second is behavior therapy that uses consultation setting on parents and teachers on behalf of in-school and home management. And the third is parent training that uses psychoeducation and learn to manage ADHD patients. The second intervention is medication or pharmacological. The first is stimulant that uses a first-line medication for ADHD patients. There are two kinds of drugs that use and approved by FDA. The first is methylphenidate that act like serotonin or epinephrine reuptake inhibitor. For the dose, in child aged 6 until 17 years old, give 5 mg once or twice a day, with dose increasement for 5 until 10 mg until optimal dose is obtained. The second is amphetamine that blocks the reuptake of serotonin and norepinephrine. The dose for child in age 3 until 5 and 6 or more years old, give 2.5 mg once a day and 5 mg once or twice a day, followed by dose increasement for 2.5 mg until the optimal dose is obtained. If the optimal dose is not obtained and the parents not approve to give stimulant on their children, give non-stimulant drugs. The first is atomoxetine. The dose is 0.5 mg/kg per day with dose increasement until 1.2 mg per kilogram per day after a minimum 3 days after initial dose. And the second is alpha-adrenergic agonist. It consists of clonidine and guanfacine. That the stimulation of alpha-adrenergic agonist receptor in the prefrontal cortex improve the inattention, hyperactivity, and impulsivity.
Hello, my name is Dino Sungwa Thomas Nuloyo, student number 045. For the conclusion, attention deficit hyperactivity disorder or ADHD is a psychiatric disorder that affects the activities of a child to function properly. Although the cause of ADHD is still unclear, the combination of genetic, neurological, and environmental factors is believed to contribute in the development of this disorder. In diagnosing ADHD, psychiatrists have to use and follow certain criteria from the International Manual as a guide. They can use the criteria from ICD or DSM. The detection of ADHD can be done by asking patients' parents or relatives about the patient developmental milestone, like crawling, walking, and talking. There are two kinds of intervention for treatment of ADHD. The first one is medication by methylphenidate, amphetamine, atomoxetine, and alpha-adrenergic agonist. And the second one is psychosocial treatment by parents training, intensive behavior medication, and social skill training. Thank you.
Okay, that's all from our presentation. Thank you for the attention, and we close it with Paramasanti. Om Santi 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 Om.